Over the last couple of years, I've worked with a number of individuals who heavily rely on their shoulders for what they do, whether that's elite tennis players, baseball players, a car mechanic, or even a young gymnast who was out for months due to shoulder pain and couldn't properly train because she couldn't put any weight on her arms. And I've learned a lot in that time that can really help you to quickly recover from any shoulder pain you might be having. So if you've got pain or you've been diagnosed with a rotator cuff tear and you want to avoid surgery, then you've got to watch this video. Coach E here from Precision Movement, and I'm joined today by Stan, who's going to help us to explain the true function of the rotator cuff. Now, what is the rotator cuff? Quick anatomy lesson here. Classically, the rotator cuff is the group of muscles responsible for this movement, which is external rotation, and this movement, which is internal rotation. There are four muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. Now, that's the classic function of the rotator cuff. But what the rotator cuff is really more important for when it comes to the shoulder and proper shoulder function is maintaining alignment of the head of the humerus. The humerus is this bone, the head is right here, which is a ball. Maintaining the alignment of this head of the humerus in the socket. And the socket goes on the scapula here, the shoulder blade. If the rotator cuff isn't functioning well and you're moving your arm around, then what can happen is you lose alignment, you lose centration, which is keeping the head of the humerus centered in the socket here. And that can result in pinching on the tendon, which is that sharp pinching pain when you lift your arm up overhead, like so, or trying to grab something from the top shelf of a cupboard. So that is the most important function of the rotator cuff group of muscles. Now, we often hear about the diagnosis of a rotator cuff tear, whether it's a partial thickness rotator cuff tear, which means the tendon has a partial tear in it, or a full thickness tear of the rotator cuff tendon, which means that the tendon is fully torn off. Now, something that's very interesting is that there are many studies showing that people have rotator cuff tears, both partial and full thickness tears, but they have no symptoms. They're asymptomatic. For example, the systematic review titled aptly Asymptomatic Rotator Cuff Tears showed that approximately 10 to 30% of people have partial thickness tears, while 5 to 20% of people have full thickness tears. And these people are all completely asymptomatic, and this is across many different ages. And they did show that as you get older, the prevalence of tears, whether partial or full, increases. Based on this study, we can deduce that it's not necessarily the fact that you have a rotator cuff tear that causes pain. So if it's not a tear that's causing pain, what is it? Well, the next study I'm going to cite shows that it's not about the structure, but the function. The study is titled Differences in Scapular Motion and Parascapular Muscle Activities Among Patients with Symptomatic and Asymptomatic Rotator Cuff Tears and Healthy Individuals. The researchers divided the subjects into three groups: symptomatic, asymptomatic, and healthy. They then measured scapular upward rotation and muscle activity of the upper trapezius, levator scapula, and rhomboid major muscles. And they found that scapular upward rotation was significantly less in the symptomatic group compared with the asymptomatic group. The activity of the levator scapula was significantly higher in the symptomatic group compared with the asymptomatic and healthy groups, and the activity of the upper trapezius was significantly higher in the symptomatic group compared with the healthy group. So what this study clearly shows is it's not whether or not you have a rotator cuff tear that causes your pain, it's the way that your muscles and your body functions. And that's what I'm going to show you how to fix with the exercises in this video. Now, you might be wondering if you should get surgery or not. Well, if you've got a full thickness tear and pain and your doctor's recommended surgery, you've seen the surgeon, then it's a good idea that you get that surgery. But regardless, if you have a tear or no tear, pain or no pain, the exercise I'm going to show you will restore proper function of the shoulder that even if you get the surgery, you're going to need to restore that function anyway to prevent another tear from occurring. So let's get moving. Before we revamp your shoulder function, I want to give you a couple strategies if you've got a high level of pain. So if your pain is at a 7 or more out of 10, from 0 to 10, with 10 being severe. These exercises will really help you to get that pain down below a 7, because if your pain is really high, you're not going to be able to perform the next group of exercises properly. If your pain is below 7, then you can just skip to the next group of exercises. So the first thing is just ice. Now, there's some controversy around ice, but the bottom line is that ice used for a short period of time can help to decrease that pain level. So ice the area for 15 minutes. You can do that 2 to 3 times a day, and that can help. The next is my favorite modality when it comes to quickly decreasing pain is contrast therapy. And that's when you're in the shower, 30 seconds hot, and then go 30 seconds cold. Repeat that 3 to 5 times total, and you'll find that your shoulder feels a lot better after that. And the final recommendation to help you get your pain level down is isometrics. And we're going to do the 4-way shoulder isometrics. And this is very safe to do regardless of the level of pain. And if you do it in the way that I'm going to show you, you can do it and quickly increase function and improve function while decreasing your pain. So the first thing you're going to do is set yourself up in as best posture as you can, and you're going to keep your elbow by your side. And all we're going to do is 4 different isometric muscle activations. That's no movement. The first is we're going to grab over your wrist, and you're going to do external rotation. So it's as if you're doing this motion, but you don't let your shoulder move. So you perform that for 5 seconds, you contract, and you don't let your arm move, and then you gradually relax. Everything you want to gradually increase the activation and gradually decrease the activation. Next is internal rotation, so it's like that movement, but I'm just going to block my wrist and ramp it up, the contraction activity and intensity, and then you ramp it down. So hold that for 5 seconds. Next is I'm going to punch forward, but don't let it move, so I'm blocking my fist with my other hand, ramp it up, hold it for 5 seconds, and then gradually decrease the contraction. And finally, bringing my elbow back, going to grab the wrist and pulling it back, ramping up the contraction intensity, and then ramping it down after 5 seconds. So you'll do that 3 repetitions of each move, just cycle through the 4 different moves there, and you'll find after you do this, your shoulder pain will be decreased at least a notch or 2. And once you've done this for 1, 3, maybe up to 7 days, depending on how painful your shoulder is, you'll be ready to move to the next group of exercises. Now we're going to get to the exercises, and these 4 exercises address what I call your foundation for pain-free movement, which is based on 4 pillars: tissue quality, muscle activation, alignment, and active range of motion. And these exercises also address those things I talked about in the study previously, which is too much upper trapezius and levator scapula activation and not enough scapular upward rotation. And that's when your shoulder blades move like this when you move your arm up overhead. So these exercises are a great place to start, and there's a good chance that the exercises will bring you from wherever you are to little to no pain. And if that's true for you, then that's also a good sign that my full shoulder pain solution program will work wonders for you. And the program is more comprehensive. It includes over 40 exercises, and it ensures that everything is working properly for long-term relief and optimal function. So if the exercise worked for you, you can check that program out afterwards. The first exercise we're going to do is active self-myofascial release for your shoulder blade and your rhomboids. And the areas we're going to work with the ball, you need a massage ball or a tennis ball or a golf ball, are beside the spine before you hit the shoulder blade, so around there, and then right on top of the shoulder blade over here. So we're going to place the ball in those different areas, and you can do both sides. I always get that question: should I do both sides if I'm only hurting on one side? Yeah, do both sides, because you don't want the other side to hurt. And these exercises are designed to restore function, so you want to make sure that both sides are good. So the first thing I'm doing is I'm getting the ball, lying down on the ball, and it's on my rhomboid right now, near the spine. And I just want to relax and melt the muscles over the ball. I don't want to be super tense to start. The whole point of this exercise is to release those muscles and relax them. So I'm on the rhomboids right now, and now that I'm relaxed, all I'm going to do is, keeping my elbow straight, I'm going to do as big of circles as I can, and you don't want to go into pain-free ranges. So if my circle looks like this, that's totally fine. But do it as big as you can. You're going to do 3 circles in one direction, and then 3 circles in the other direction. Again, do not push yourself through painful ranges. We want to avoid pain and pinching and any acute sharp pains as much as possible. We don't want to irritate already irritated tissue. So once you're done 3 circles in one direction and 3 circles in the other, we'll move the ball a little bit so that I'm still on the rhomboid, but just a slightly different area. and you do the same thing. So you do 2 different areas of the rhomboid, and then you go to the shoulder blade. So the shoulder blade is more lateral or more to the outside of your body. So you just get on right on top of that shoulder blade there. And same thing, you want to relax and melt the muscles over the body. And once you're there, relaxed, you do 3 circles in one direction and then 3 circles in the other direction. And then you can do 2 or 3 areas on the shoulder blade, moving right to kind of underneath your armpit, or right behind your armpit. So you do 5 areas total, 2 on the rhomboids, 3 areas on the shoulder blade, and that will help to relax those muscles that kind of prevent proper scapular function and scapular movement. The second exercise I've got for you today is called the wall neck side bend. And this exercise is going to do a couple of things. It's going to relax the upper trapezius and levator scapula muscles, which were identified in the study as overactive in those with painful shoulders. And it's also going to start to work your scapular stabilizers, specifically your serratus anterior and your lower trapezius and rhomboids. So this exercise is one that is also very relaxing. So if you're stressed during the day, then try it out. So this technique, I used to show it without the arm cue. And the arm cue is really, really beneficial. So what it is you set your shoulder blades up by bringing your shoulders back, not necessarily squeezing them together a lot, but posteriorly tilting them. So if I'm standing sideways, posterior tilt is moving your shoulder blades like that, bringing the bottom of the shoulder blade into the rib cage. So you just want to think of that movement. So bring them back together a little bit and posterior tilt, make them flat on the wall, and then you straighten your elbows out and drive the hands into the wall with a little bit of pressure, keeping the shoulders back. The other thing you want to do is think of sliding your hands down to keep your shoulders down. Once you're set in this position, don't move the shoulders or the hands and keep that hand pressure into the wall. From here, I'm going to bring my ear to my shoulder, and I can exhale while I do that. And once I'm here, I take a deep diaphragmatic breath in. And you'll feel nice, intense stretching in the lateral neck muscles there. Exhale, and then you come up, and then you come down to the other side. And once you're at the end range of motion, take that deep breath. You can hold that breath for a moment at the end and really try to use the breath to stretch the neck muscles. And then you inhale, exhale on the way up, and you repeat. Ear to shoulder. I'm going to do one more on this side because it feels so good. Use the breath to expand through and stretch the neck, and then you come back to the middle. So the whole time you're keeping your shoulders in good position, you're applying some pressure into the wall. So you keep those scapular stabilizers on while relaxing and releasing the upper trapezius and levator scapula, which are overactive in those with shoulder pain. The third exercise I've got for you today is the lower trap activator. And this exercise does just that. It activates your lower trapezius. And this is important for proper scapular upward rotation, which was found in the study to be lacking in those with shoulder pain. For this exercise, we need some type of resistance to pull against. Now I've got a strength band here set up at elbow height, but you could as easily use just a belt that doesn't stretch. I've shown a pair of pants for this exercise before. Use something. Just be creative. All you need is something to pull against. Now here, I'm setting it up just above my elbow. I'm going to bend my elbow, and I'm bringing my elbow to my side here. Now the movement is very subtle. All it is posterior tilt of the scapula and bring the whole shoulder girdle back. Holding it for 5 seconds, and then relax. What you're not doing, and I'm just going to take the band, pretend I've got a band on me. What I'm not doing is trying to row, getting the elbow back behind my body, and you can see the result of that is my shoulder rotates downwards. My entire shoulder girdle rotates downwards. We want to do the opposite of that. We want to rotate the entire shoulder girdle upwards like that. So I'm opening the chest up, and I achieve that by bringing the shoulder girdle back with a little bit of posterior tilt of the scapula. So there, it's 5-second hold, and then you release. Again, the motion, the side view is the best. We bring the elbow down, and then it's just that. Very subtle. Keep the elbow relaxed. Hold for 5, and then you release. So that's the lower trap activator, and that's going to help to restore proper scapular upward rotation. The fourth and final exercise I have for you is one of my favorites called the shoulder rotation robot. And this exercise is great because it establishes strong and stable scapula in the presence of rotation. So for athletes like baseball pitchers or any baseball player or tennis players, we need to have our scapula working properly and stabilized while we're rotating aggressively and with high velocity. So great exercise for everybody, but especially for athletes. Start off with your back on the wall and your shoulder blades are in the same position as in the wall neck side bend. They're slightly retracted, pinched together with that posterior tilt. Shoulders are back, chest is out, and from here, my elbows are going to touch the wall, and then I'm going to bring them up just a little bit, about 20, maybe 30 degrees at max. Make fists for greater rotator cuff activation, and my elbows are at 90 degrees, and I'm going to go one up, one down. Now the key is, at the end range of motion, I'm trying to get deeper into the range with both hands. So here I'm touching the wall with my right hand here, so I'm going to press the hand into the wall. The key point is the shoulder blades don't move. You maintain that stable position. Especially after 5 seconds you rotate, you don't lose the shoulder positioning. So rotating down, you're going to want to lose it with the hand that's rotating downwards, internal rotation, but don't. That's where we're strengthening those stabilizers. Hold for 5 seconds, trying to get deeper into the range the whole time, and then slowly rotate. And again, if you could touch the wall, press into the wall. If not, you're just actively trying to get closer to the wall with your fist. Breathing. Now, when you finish this exercise, maintain good position of the shoulder, bring your arms down by your sides, maintain tightness through the body, come up off the wall, and then gradually let everything go when you're off the wall. And the reason why I like to do this is to make this the new normal for your brain. You're entering, you're exiting movements, you're doing everything in this good posture and position of the shoulders. And when you do that in the gym and when you're doing your corrective exercises, you can better take that into everyday life. To summarize the routine we went through today, we started with active self-myofascial release of the rhomboids and shoulder blade, do 2 different areas of the rhomboids and 3 areas on the shoulder blade, and do 3 circles of your arm in each direction on each area. Then we went to the wall neck side bend. Do 1 set of 4 reps per side, holding that for 1 deep breath. Next, we went to the lower trap activator, performed for 2 sets of 4 reps per side, holding for 5 seconds. And we just finished off with the shoulder rotation robot, performed for 2 sets of 4 reps per side, holding for 5 seconds. Do this routine 3 to 4 days a week, and you'll find after 1 or 2 weeks, you'll feel better. And after 4 weeks, you'll really feel good. So there you have my precision movement approach to addressing rotator cuff tears and shoulder pain. I've got a couple other videos that will really help you out. The first here on posture, because your thoracic spine posture is really important for keeping your shoulders healthy. Here we've got 5 different movements for pain-free shoulders. And finally, the shoulder pain solution, which I talked to you about already, which you could find in ROM Coach. And if these exercises worked for you today, this program is what you need for a lifetime of pain-free shoulders.